to invite Dr. Prasanta Roy, who is Associate Professor at Department of Clinical Psychology, Institute of Psychiatry, Kolkata, and request him to deliberate his expertise and experience on how the psychological intervention works to cure or treat the mental or emotional crunch with which many of us are living in the ongoing pandemic, COVID-19.
Okay.
Over to you, sir.
Thank you, National Institute of Disaster Management, for planning this topic to discuss about the psychological perspectives related to pandemic mental health. And thank you considering me for this discussion as part of the panel. Uh, what Dr. Bhadra has discussed about the approach of psychological first aid. So I am going beyond that. But before I start the discussion, let me focus on some of the stories. This is a story of Antara, who is a psychologist, young psychologist teaching in a school as a school counselor. And she lost her father in COVID around a month back. And what was happening even after the month, she was continuous in the denial mode. She was refusing to believe that father has died. If anybody was telling about any ritual related to the death of father, she was becoming very much abusive or violent towards that particular person. And there was evidence of regressive behavior. She was showing more clinging behavior, and her talking was more in a childish mode. Was playing in some of the childhood toys. So this kind of regressive behavior was evident, and she was not even willing to talk to any of her friends who were psychologists. So this is one story. Let me go to the next story of Banti. Banti is a researcher. He is doing his research in one of the IITs, and he had COVID 1 year back. And even after 1 year, he is continuously having sleep disturbance. He is getting intermittent wake up spell, and in the morning he doesn't feel fresh, and he is having occasional problem of breathlessness for a short period of time, with excessive fear that something bad might happen again to him. And he is also having frequent nightmares during his sleep. And because of all these things, he is not being able to focus on his research writing work. Now, this is story of Chitra. She is undergraduate college student, and she is part of a voluntary body who are working for the people affected by COVID or affected by lockdown as pro bono basis. However, due to some of the experience, he easily gets frustrated, irritated, and she was telling that if I am telling someone to follow this particular, now your husband is so sick, better to hospitalize him immediately. And she reported that the wife was telling, no, I want to wait for this night. At night it might be difficult. Let me see, maybe by tomorrow his breathing problem or his oxygen saturation level might have changed. So she feels extremely irritated, sometimes becomes very aggressive towards those people wherever she is going to provide her help. And all these things are creating a sleep disturbance in her, because all the thoughts are coming continuously in her mind. And she is telling like, I must be helping others at any cost. So these are three different scenarios that all of us who are working with the people with pandemic might have experienced, or maybe the family members are also experiencing similar kind of thing. People. Now, with this in the background, last year I conducted an online survey in West Bengal, and in this survey around 1,000 people were there, and none of them had COVID during that time. And we tried to assess the kind of the traumatic impact they had. And in this traumatic impact, we found that around, forget about this data, I'm not getting into this detail, around 50% of the total population, I found that they had moderate to severe level of traumatic impact. Moderate to severe level of traumatic impact. But what is going to happen with this 50% of the people, as Dr. Bhadra was telling, that around 90 to 95% people might recover within 2 to 3 weeks, provided they get some kind of psychological first aid or the kind of support system that in India we are proud of. But there are some number of people. We found that around 10.3% of the population who didn't have COVID, they had extreme level of trauma reaction. And what can happen with these people? We need to focus on the entire 50%, and at the same time we need to have special attention for this particular 10% of the population, because they are vulnerable. They are vulnerable, and that vulnerability can amount to suffer from depressive disorder, anxiety disorders, panic disorders, even suicide, post-traumatic stress disorder. All those things happen. And some of the reports have already suggested that during any kind of pandemic in last previous year, like in 2003, even 100 years back during the Spanish flu, there was around 10% of the population who became more suicidal during this pandemic period. So we have to be quite careful about the warning signs, and if these particular warning signs are there for more than 2 weeks, then obviously the mental health professionals to be consulted immediately. And I'm not going into the details of the warning signs, but it includes sleep problems, significant weight loss, suicidal act. If there is suicidal act or suicidal intention or suicidal thought, better not to wait for 2 weeks. Immediately to consult the mental health professionals. And if there is increased use of alcohol or drug, or if the person is becoming violent or aggressive, all those things are warning signs. Now, what kind of psychological intervention we can think about other than psychological first aid? So, whosoever is the client, whosoever is the patient, whosoever is the sufferer of mental health issues, we need to primarily focus on the psychological first aid for all. Psychological first aid, and that includes the 5 essential elements, as Dr. Bhattara told. We need to focus on where the person is going to feel safe, whether with somebody the person is going to feel safe, whether in absence of somebody the person is going to feel safe. Mostly during this pandemic period, the person feels safe when he or she is with the other people. And we need to try to do something so that the person can calm down a bit. Maybe we can provide, if the face to face in hospital basis, we can provide some kind of some water so that the person might feel calm. And even in the digital basis or online basis, when we are trying to talk to the person, we can suggest the individual, will you feel better if you take some water? Will you feel better if you keep one pillow with you, or maybe a teddy bear with you to hold on, so that you feel more calm and more comfortable? So this calming experience can be helpful. And connectedness is being already told. First connectedness is that your reactions are normal because the situation is abnormal. That is the first connectedness. Second connectedness, with whom you would like to stay, with whom you would like to share your experience, your thought. So that is second connectedness. And third connectedness, the kind of problem you are having, will you connect yourself with the helpline or the telecounseling modality? So this is third level of connectivity. And in all these situations, what happens many times when family members are providing kind of support, they give the suggestion, and they expect that the person who is the sufferer is supposed to implement those suggestions. Here, one important point that we need to remember is that we need to enhance the self-efficacy of the individual, and we need to rely on the self-efficacy of the individual. We can give some kind of suggestion. I think probably if you do this, that would be better. But what is your opinion? What you would like to do? So the decision making, if you keep on the individual, that is always helpful. That will improve the self-esteem of the individual. And obviously, finally, we need to maintain the hope in the individual that this problem will be over maybe within 2 to 3 weeks, or maybe within a couple of few days. We are sure that things, the problem that started, that will not continue. So this kind of hope is always needed, so that there is a possibility of improvement or recovery. But what happens during grief? Grief is a normal phenomenon. All of us are having grief reactions when there is a loss of any significant member. And there are various aspects of grief. Though there are 7 stages I have highlighted here, but all persons might not experience all the stages. And sometimes those stages may come in a very haphazard way. But we have seen that many people, even during this pandemic particularly, the grief reaction is becoming more complicated, more difficult one. Reason might be this is unexpected. Death is very much unexpected. Large number of people are dying. Even in some of the families, 2 or 3 people are dying. And the third aspect about is there is no closure after death. There are no rituals. Even many people are not unable to see and unable to do the funeral process. So all those are creating lots of shocking experience, and this shocking experience can stay for few hours to a couple of days. That can be a normal phenomena. And many people are into denial mode that I discussed with the story of Antara, and that people are not accepting that is also a normal phenomena. And sometimes anger can be there. Anger can be associated with the hospital nursing staff, the doctor, even towards the family members, sometimes towards me. Why didn't I think before? So the anger is another phenomena, and the bargaining is another issue. Bargaining means sometimes accepting the death. Again, no. Probably there was, I'm thinking in a very wrong way. How can I think that the person has died? No, this is not good. And then the depression appears in the individual, and with the depression, the person start testing the realistic solutions, and the gradually acceptance happens. It can take 1 week. It can take more than around 1 month for some individual. But if it is going more than 3 weeks, then obviously we need to focus on that particular person so that his or her grief experiences reduces. And for grief experience, we need to remember that there would be some phases where person will be having more grief reaction, and there will be some phases of life where the person will have less grief reaction. And sometime during the holidays and during some particular days, the grief reaction would be more prominent. And this grief reaction to some extent can continue throughout the life. It doesn't mean that all the grief needs intervention. All the grief needs intervention. One thing that we need to focus on, grief is a normal phenomena, and there is no need to hurry up. Do need to put pressure on the individual that you come out of the grief immediately, then it would be good for you. No, we need to give the some kind of, there are individual differences. We need to give some time to help them with their own resilient capacity. Each and every individual is having some amount of resiliency. And some of the other things that we can do is in grief counseling, the family members also can review what are the grief reactions in the thought, what kind of emotion the person is experiencing, what kind of behavioral reaction the person is having, and what kind of biological reaction, like how is the sleep, how is the energy level, how is the appetite. So these grief reactions we need to review by asking the individual, and then we can rebuild the relationship of the patient with the disease. What kind of relationship the particular person used to share, what are the things you liked in that particular person. So how will you evaluate the relationship? What kind of name you would like to give to the relationship? What are needs used to be fulfilled with that particular person? What are the things you didn't like about that particular person? What are the things the person didn't listen to you? So both the positive aspect and the negative aspect of the relationship, we can ask to the person without forcing the person to accept the death. So that has been found to be quite helpful. And sometimes description of the sequence and consequences of the events which had happened just before, during, and after the death. Understanding of the entire process, the past, present, and the future of the death experience, that can be helpful in accepting the death, some people. But it may not be on the very first day. Maybe sometimes on the second day or the third day, we can go for this sequencing of the event. And we can explore the associated feeling about that the person is not here, unable to see. There is a confusion that the person may not be leaving. So what kind of negative feelings the person is having? Maybe at later period we can also explore some of the positive feelings. Yes, person start experiencing after 2 or 3 sessions some kind of positive feeling associated with it. Maybe through remembering of some pleasant event with that particular person, some positive emotion might come up. So those things can be helpful. Consider possible ways of being involved with other people. What are the needs that used to be fulfilled through this particular person? Are there any other individual that to some extent those needs can be fulfilled? So this is another important issue to deal with grief. So the important is whether it's a loss of a person or a loss of a relationship. And we need to communicate the relationship stays for the life. And it is only the absence of the person, the physical absence of the person. And whether it's the loss of a person or the loss of the needs. Mostly we'll find that our needs that used to be fulfilled through that particular person, we miss that particular issues prominently. Sometimes writing a grief letter can be helpful, and if you can write down addressing to the deceased person, and maybe we can leave that letter on the water to flow, that can be helpful. Getting some kind of support system during this grief period can be quite helpful. And again, some people again having difficulty in telling that okay, one family member has died, how to communicate to the other member, that is breaking bad news. I might not be able to go to the detail of breaking bad news because of the time, but here we need to find a comfortable place where the person would be willing to talk. Then we need to assess the kind of perception the individual is having, kind of knowledge the individual having, that what kind of suffering that the diseased person had, what kind of difficulties you anticipated, what doctors told. So this kind of perception that we need to assess. Then we need to invite that particular person that we would like to discuss about the kind of suffering that particular person was having. Are you okay? Is it okay for you to discuss? Is it fine that we can discuss about the kind of problem you had? Once the person accepts the invitation, we try to give some kind of knowledge. What was the treatment? What was the symptoms? What was the diagnosis? All those knowledge we try to provide. And then the emotions comes up. We acknowledge the emotions. We facilitate the emotion. We allow the persons to show the emotion with empathy. And then we plan about what can be the next session, what are the things we need to focus, how many days the persons we need to talk to. So all those are part of breaking bad news. What are the other interventions for other problem, like breathing or muscle relaxation exercise can be helpful. Slow inhaling, then giving a pause, then slow exhaling. And while you are inhaling and exhaling, just be aware that your chest must should not expand. It is your abdomen. You are relaxed. Your shoulders are relaxed and not tight. So slowly, maybe for 4 to 5 seconds, you inhale, then give a pause so that you are aware about that you are taking a deep breath, and then let it go slowly. If you can practice it for 5 to 10 minutes, that can be extremely helpful. Mindfulness means becoming aware about what is happening. Mindfulness of our daily activity whenever we are eating. If we can be mindful about the taste of the food, the texture of the food, the smell of the food, the color of the food. Even when you are taking bath, when the water is flowing on my body, the kind of experience, kind of sensation that I am having in my body, I can be mindful about it, or I can be mindful about the normal breathing that is going on. Just being aware about it. Whatever time possible, 1 minute, 2 minutes, that can be extremely helpful. 3 minutes breathing space. It is having 3 components. It takes 3 minutes. First component is awareness. Sit in a comfortable posture, maybe on chair, with straight body in a dignified position, maybe with closing eyes, and just be aware about your body posture. Just be aware about the kind of thoughts you are having, kind of body sensation you are having, kind of emotion you are experiencing. After this awareness, then you gather. The gathering is anchoring. Where you are anchoring? You are anchoring your normal breathing. The breathing that is going on. Just focus on the breathing. Just be observed when you are breathing in what is happening, when you are breathing out what is happening. After gathering for 1 minute, and the third part is expanding. And then when you are breathing in and breathing out, what kind of experience you are having in your facial expression, in your other body parts. So that is expanding. It has been seen that if you practice the 3 minute breathing space 4 to 5 times daily, and along with whenever I am having some emotional difficulty, thought related difficulty, as SOS, it can help in coping with the difficult situation. When there is a storm inside the sea, what the sailor do with the ship? He doesn't do nothing. He does nothing. He only throw the anchor in the ship. It doesn't stop the storm. It provides a kind of stability. So this anchoring or gathering is to provide the stability, not to get rid of the storm. If it is reducing the experience of storm, that is to be considered as bonus. There is panic control technique. People are experiencing a lot of panic attacks nowadays, and what they do, they try to inhale more and more so that they can get oxygen more. It doesn't happen. What has been seen that instead of inhaling, if they focus on exhaling slowly, just let the carbon dioxide move out, and the breathing will be in an automatic process. So through exhalation, many of them are able to control their planning strategy. Sleep hygiene is a technique where to maintain a particular time for sleep, wake up time, going to bed time. If the getting into sleep is taking longer time, it should not interfere with the wake up time. So it should be fixed. And then cognitive restructuring is come to many people will have some kind of irrational thought, irrational expectation. We can question them. What are the evidences? Why are you thinking this? Who told this about you? The person is telling probably that I'm going to die. But where from you got this information that you are going to die? How many people have told you that you are going to die? How much you believe that you are going to die? So the questioning this kind of expectations can be some kind of helpful to discover that my thought was not rational. And trauma focused approaches, there are various techniques. I'm not going into the detail of it. And for volunteers, self-care is one of the most important thing. Before I start going for volunteerism, we need to ask whether we are ready to help. And sometimes the friend is telling me कुछ चलो 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 help करते हैं, बहुत जरूरी है. And because my friend is telling I'm going to that, no, we need to ask whether I'm ready to help. Are you connected with a group of organization for safety or coordination? That is important. अकेले अकेले हेल्प करने जाने में प्रॉब्लम ज्यादा होगा. Just be with an organization so that you feel more safe and connected. Second, during volunteerism, what are the things you can do? How can you stay physical and emotionally healthy? That you have to focus on. Proper nutritional food, no much gap in between food, and the sleep time should be proper. Again, you can practice some of the breathing exercises that can be helpful. How can you know your limits? That is important. Everybody cannot do everything. And volunteerism doesn't mean going beyond my capacity. Whatever your capacity is, communicate to your voluntary group and go by that. Otherwise, you are going to be the victim. Our expectations are rational. And see, what other person are going to do, that is under not our control. What I am going to do, that is under my control. So many people might not follow lots of things. Let us unconditionally, non-judgmentally accept them. Okay, whatever they are thinking based, they are doing. What can I do about it? Nothing. And how can you and your colleagues support one another? That is important. Whenever having some kind of emotional difficulty, share with your friends or peer members so that they can support each other. And after your volunteerism is over, how can you take time to rest, recover, and reflect? That is important issue of self-care, so that next time whenever you are going for volunteerism, you are more resilient, more modified, more organized. With this, thank you.
Thank you very much, sir, for such a descriptive presentation. Very wonderful presentation. You have narrated the story of Antara, Benji, and Chitra with the different situations and conditions. You have also discussed five essential elements to focus on. That is a safety, calming, connectedness, self-efficacy, and hope. You have also shared the everyday life experiences, the six steps of breaking bad news, and the self. You have also talked about the self care is also necessary in helping others. so that you could not become a victim. Thank you very much, sir. Thank you.